I believe there is no woman out there who would not wish for dense, shiny hair. If you take a closer look at an average woman's life, you'll realize that it is much more stressful than that of a man's. Women are expected to follow certain stringent social norms, for example, getting married, bearing children, as well as taking good care of those around them, which is fine. But in India, women are expected to be nothing less than superwomen, capable of doing all household chores by themselves, as well as being competent at their place of work. All of this could lead to a state of havoc in their bodies, which could in turn lead to certain hormonal disturbances responsible for hair fall in women. Both men and women all over the world apply several hair care products, only to find themselves disappointed at the end of the day, as most of these products are not evidence based and have no mention in medical literature. So, in this video, I, Dr. Akanxa Bhatti, am going to tell all the women out there how they could combat hair fall by figuring out what the cause of hair fall is by going through certain lab investigations. And I would also be providing certain treatment options, both medical as well as surgical, which you could opt for in the future if you are suffering from hair loss. So stay right there. Hair loss in women is usually more complicated to understand than hair loss in men. Women usually start experiencing hair thinning right in the front of the head. This might not be a cause of concern unless and until they do not see some of their photographs or look into the mirror to find that they do have a see-through scalp. A see-through scalp right in the front of the head in women might not only be a cosmetic concern, it might also indicate that their bodies are shouting out for help. In fact, some of my female patients got to know about their health conditions only after I asked them to get certain lab investigations done. Some of the common causes of hair loss in women include PCOS or polycystic ovarian syndrome, which presents with hyperandrogenism in women, thyroid related issues like hypothyroidism, hyperthyroidism, and other autoimmune related thyroid abnormalities. A very common cause of hair loss in women in India is iron deficiency anemia and other nutritional deficiencies. A very distinct form of alopecia in women is traction alopecia. This occurs in women who wear very tight hairstyles for prolonged periods of time. For example, wearing very tight buns, ponytails, or even cornrows like in African women. Let's go through each of these causes of hair loss in women in detail. To begin with, let me discuss about hair fall occurring secondary to a thyroid condition. The most common thyroid condition that I have seen amongst my female patients is hypothyroidism. Women who are hypothyroid often complain of typical symptoms such as excessive gain in weight over the past few months, irrespective of their dietary habits, irregular menstrual cycles, feeling low throughout the day, feeling confused, irritable, and even forgetful. They might also have excessive sensitivity to cold environments and might also have constipation. If you have any of these symptoms that you're experiencing, and on top of that, if you have a swelling in front of your neck, then you should get your thyroid function tests done, as this would help you to find the cause for your hair fall. Thyroid function tests include serum TSH, that is thyroid stimulating hormone, T3 and T4 levels. If your serum TSH is high, then you should go ahead and get your anti-TPO antibody levels checked, as this would rule out any autoimmune causes of thyroid problems like Hashimoto's thyroiditis. Once you've been diagnosed with a thyroid condition, it is best to go to an endocrinologist and get yourself treated for it for a few months. After a few months, you could get your serum TSH levels checked again, and if they are normal, you could go ahead with any options which are available to you for your hair loss. For example, even hair transplant. Another common cause of hair loss in women is hyperandrogenism, in which there is an increase in the male hormones in a woman's body, especially testosterone levels. This might occur secondary to a syndrome known as PCOS or polycystic ovarian syndrome, in which there are typical symptoms that a woman experiences, like difficulty to conceive, irregular menstrual cycles, acne, excessive weight gain, and even mood swings. If there are any of these symptoms in my female patients, then I would advise them to do certain lab investigations like free as well as total testosterone levels, DHEAS, 17-dehydroxyprogesterone, LH, FSH, and even insulin levels. If the LH is to FSH ratio is high and there is an increase in the insulin levels, then there is a high possibility that the woman has hyperandrogenism. These women need to be treated by an endocrinologist for their condition, and side by side, they can also undergo medical treatment for their hair loss. The most common cause of hair loss in women in India is still nutritional deficiency. Iron deficiency anemia, zinc deficiency, biotin deficiency, as well as iodine deficiency cause hair fall in women. If a woman looks pale and feels tired throughout the day, I would advise her to go ahead and get her ferritin as well as hemoglobin levels checked. And if they are low, I would start her on capsules of ferrous sulfate for at least 6 months. After 6 months, I would again reassess her hemoglobin levels. And if they are normal, then we could always go ahead with a hair transplant. Some women who present with a large swelling in the front of the neck might be preparing their meals with salt that is deficient in iodine content. So it is advised that women use proper iodized salt to prepare their meals, as this could affect your thyroid. Some women might experience aggressive, severe hair fall right after delivering a child. This is known as postpartum effluvium. This condition usually reverses itself on its own, but minoxidil can help in regaining the hair that you've lost. Traction alopecia is a condition which occurs in those women who wear very tight hairstyles, like I told you. These women do not require any medication, but minoxidil does help to increase the density in the transplanted hair. These women usually require a hair transplant. Telogen effluvium is a condition in which women might experience aggressive sudden onset of hair loss. There might be clumps of hair which might fall off with the slightest of force applied to the hair shafts. This usually occurs after a major life-changing event like the death of a loved one. These women should see a psychiatrist who would help them with their stress and also help them to enjoy life. This condition usually reverses itself as the stressor is removed. But minoxidil does help these women to increase the density of the hair. Androgenetic alopecia in postmenopausal women can be treated with the help of a DHT blocker at a higher dose than that used for treating male pattern baldness in men. Women have no side effects with DHT blockers. These women can also greatly benefit from the local application of 2% minoxidil solution or foam. Spironolactone is a medication used for treating hair fall in women who are in the reproductive age group who have not yet achieved menopause. Spironolactone is a medication which is to be used very cautiously and is to be used only after you've received a prescription from a doctor. The lab investigations would include renal function tests, liver function tests, serum electrolyte levels, and the BP of the woman should also be checked before starting her on spironolactone. The message to take home here is that if you have any medical issues or any nutritional deficiencies, you should first take care of those and then go ahead for a hair transplant. Because otherwise, you would be left disappointed as the pathological process of these underlying conditions would still continue and you would continue to have hair fall right after a hair transplant as well. If you found this video informative, please do not forget to like this video. Also subscribe to my YouTube channel for more such videos regarding hair fall and hair restoration surgery. If you have any questions that you would like to ask me, Please drop your questions in the comment section below. I would be happy to answer all your questions. Thank you for watching.